Good evening, everyone, and welcome to BioVanguard Cell Talk presentation. For today's presentation, Ananya is our presenter and she will be discussing on the topic Getting Myself Motivated is the Challenge, a qualitative interview study exploring barriers to cancer screening among lonely and isolated people in Denmark. So before starting the presentation, let me introduce Ananya. Ananya Khan specializes in population research, focusing on aging, the socioeconomic challenges of marginalized communities, and gender dynamics. She holds a master's in population studies from the International Institute for Population Sciences, Mumbai, and a master's in geography from Vishwabharati University, Santiniketan. Her academic background has equipped her with expertise in demography, statistical analysis, GIS, and research methodology, making her a valuable contributor to the interdisciplinary research initiatives. Ananya is also actively involved in projects addressing socioeconomic disparities and health challenges, particularly among the aging population. Now, I warmly welcome Ananya to start with her presentation.
Thank you for the introduction, Uma. Good evening, everyone. And today I will be presenting a research work titled Getting Myself Motivated is the Challenge, a qualitative interview study exploring barriers to cancer screening among lonely and isolated people in Denmark. So, cancer continues to be a significant public health challenge, ranking as a leading cause of death worldwide and in high income countries. Despite extensive research in modifiable factors for cancer, such as tobacco, alcohol, and diet, the influence of psychosocial factors, such as particularly loneliness and social isolation, remains relatively unexplored. And loneliness and social isolation has been recognized as the potential determinants of health. Globally, loneliness shows a marked increase, with 1 in 4 people feeling very or fairly lonely. According to previous studies, 27% of men and 34% of women in Denmark report feelings of loneliness. And social isolation was associated with 23% of increased risk of cancer mortality, which thereby highlights the urgent need to understand implication for cancer prevention and cure, and the importance of social networks in motivating people to engage in screening. Despite these insights, the relationship between loneliness, social isolation, and participation in cancer screening remains poorly understood. Therefore, the study aims to identify barriers to cancer screening among lonely and isolated people in Denmark and to explore strategies to improve their participation. It is a qualitative study conducted in Denmark. The data was collected between August 2023 to October 2023, and purposive sampling was employed for recruitment of participants. They were recruited via organizations, local associations, self-help groups, and municipal services, which were aimed at reducing loneliness and social isolation. The participants included were people with lived experiences of loneliness and or social loss. There were 32 participants, among which 20 were women and 12 were men, within the age range of 47 to 74 years. To create a safe conversational space where participants could share their experiences without feeling exposed or judged, the questions were framed in a hypothetical third person perspective rather than direct inquiries. Participants were provided with an information sheet, a consent form, and a short questionnaire assessing various background information, and 3 item loneliness scale, which is a 3 point Likert scale where high score indicates increased level of loneliness. And the data analysis was rigorously conducted through Malterud's systematic text consideration method, which has 4 distinct stages. First is forming an overall impression. Next stage is decontextualizing the text to isolate meaning units, and then recontextualizing these units within the broader data set to ensure they are ensured that they are reflective of the data as a whole. And finally, synthesizing this process into a novel understanding of the research topic at hand. The interview was structured in six individual interviews and six group interviews. Individual interviews were averaged at 61-minute length, and group interviews were averaged at 50-minute length. The study took comprehensive measures to ensure participants' dignity, respect, and emotional safety. Given the potential for distress, it was assured that the participants could pause or terminate the interviews and will be offered a follow-up support for debriefing or counseling if needed. Most participants, as per the results, most participants in the study were either retired or receiving social income. 14 participants were married or in a relationship, or and five reported having no children. Among the participants, two were cancer survivors. Additionally, 20 participants disclosed having chronic medical conditions. Eight participants scores indicated moderate loneliness, and nine participants indicated severe loneliness. The study has derived three main themes to describe the important aspect among lonely and isolated people to engage in cancer screening. First is the invisible barrier to and motivation for screening participation. Second is ambivalence towards self sampling. And third is the power of presence. Most participants had undergone cancer screening at least once, but regular participation and awareness were lacking. The participants revealed that their struggles with loneliness and social isolation often intersected with their healthcare decision making process, presenting an invisible barrier to screening participation. Plus, external circumstances had a greater impact. A participant who has experienced prolonged illness and subsequent COVID-19 isolation found it difficult to rebuild social skills and returning to normalcy, which thereby made them feel drained and disengaged from healthcare decisions. Some participants got the motivation from fear of developing cancer. Our participant who had colorectal cancer in their family, which is hereditary. A participant who had colorectal cancer in their family, which is hereditary. So, despite having feelings of demotivation stemming from experiences of loneliness, the reality of heightened risk, cancer risk, and the association with death motivated these participants into action. Other participants suggested that straightforward communication could be far more effective for raising awareness than advertisement. Adopting humorous and positive tone and hearing cancer survival stories with early detection could increase motivation. Participants revealed high familiarity with self-sampling for colorectal cancer screening program, but were less aware about self-sampling for cervical cancer screening program, and also raised concerns about accuracy of self-sampling, and suggested that providing more on the benefits and reliability of self-sampling methods and guidance from their general practitioners could help ease this skepticism. A main obstacle to participation in cancer screening program among the participants was their lack of self motivation. Many participants described a need for external motivation or a push to initiate action towards participation. The influence of personal networks, including caregivers or support helpers or support groups, was often cited as crucial in providing that necessary push. Many participants also mentioned that once they had started participating, things became easier, and that it was just a matter of getting started. Besides that, dependence on external motivation and support system acted as motivation mostly among females compared to males. The study revealed that while most participants had engaged in cancer screening at least once, regular participation was uncommon. The major obstacles in regular participation was the self-motivation in reaching out and scheduling or traveling to appointments and consistent engagement. The impact of close relationships were such that people who were in a relationship relied on their partners, and those living alone expressed a need for more support and more engagement. The participants suggest that pre-booked appointments for screening, reminders from their general practitioners, and or personalized outreach could improve awareness and motivation. Additionally, self-sampling was generally received positively due to its convenience and privacy. The study also highlights the need for strategies that focus on the emotional and psychological barriers rooted in loneliness and isolation. One of the notable strengths of this research was its ability to engage with populations typically considered hard to reach. The study made efforts to ensure participants' comfort, facilitated open and nuanced discussions, which was crucial for the sensitive nature of the research topic. The findings of the study are applicable across nations. The study utilized an indirect approach to discuss loneliness. Although indirect approach was ethically sensitive and considerate, it may have constrained the depth of insight into direct experience of loneliness. Secondly, some nuances and intensities of loneliness could be underrepresented due to the cautious framing of questions. Lastly, the oversimplification of cultural context could influence the expression and interpretation of loneliness. To increase the motivation and engagement for participation in cancer screening among those feeling lonely and isolated, future interventions should prioritize awareness and social support. Awareness strategies should offer clear, accessible information. Additionally, tapping into social networks and community organizations for spreading information, community outreach efforts for motivation and engagement, expanding access to self sampling options, and face to face interaction are some of the strategies to increase participation. Therefore, the study reveals a paradox that high interest in cancer screening does not lead to regular participation. A multifaceted strategy enhancing social networks and providing clear, accessible information can increase participation and better integrate lonely or isolated populations into preventive healthcare. And this approach might be helpful not only for increasing screening participation rates, but also for integrating vulnerable populations more fully into the preventive healthcare initiatives. Thank you.
Thank you, Ananya. Thank you for the presentation. Audience, now the floor is open for Q&A session. If you have any queries, please type in the chat box. Okay, there were no questions. So I think with this, we can conclude the session. Thank you, Ananya. Thank you for the presentation. And I thank everyone for attending the session.